I mean, historically, the Cleveland Clinic as an enterprise has done less than 2% of its total care virtually. The Neurological Institute was probably somewhere closer to between 4 and 5%. And we went from that to 75% or more of our care being provided virtually over the course of just a couple of weeks. So it was a very, very dynamic process. It was really fueled by obviously the requirement for social distancing, the need for us to continue to connect with our patients in a meaningful way, to be able to provide services to many of our patients who not only had challenges for travel, but were immunosuppressed. And it required a lot because the traditional platforms that we use to communicate with our patients virtually initially just couldn't withstand the additional traffic. So we were able to take advantage of some of the allowances from HHS, and we were able to use things like FaceTime and Google Duo in order to contact our patients and still maintain that really important contact virtually. Well, I mean, our traditional platform obviously is HIPAA compliant. It allows patients a very consistent experience. They go into a virtual waiting room and they connect with the provider there. For a short period of time, we were, calling our patients on FaceTime and Google Duo. These platforms are excellent. They work very, very well. Not all of them are HIPAA compliant, obviously. And so in the future, we're going to be transitioning to more secure ways to connect with our patients. But I think that, we very early on put a lot of effort into helping our providers who were new to virtual care, new to distance health, learn to use these applications. We made a commitment to just a couple of applications early so that we could adequately support our new providers. And we made it a point of educating our patients as we were transitioning them from in-person to virtual care to make sure they knew what application to download, how to use it. So we had a lot of quick reference guides out there on the internet very early on and sent out to patients so that they could have a pleasant patient experience as we made that rapid transition. I think that's something we're going to have to look at very closely on the patient side of things. I mean, we did whatever it took to make those contacts. Many times we did just have telephone conversations with our patients when appropriate. Certainly, whatever it took to provide patients with to meet their needs wherever they were. But as our platforms have stabilized, we've been able to provide a more consistent virtual experience for our patients. And the initial response has been very, very positive. A lot of patients that in the past may not have tried any of our virtual visit options have had an opportunity to use them and really find them extremely convenient and are very interested in continuing to use those going forward.